Good evening, and thank you for joining us for this virtual town hall meeting. My name is Jessica Davis, and I am the 2019-2020 Minnesota State Teacher of the Year. I've spent the last 11 years working as a high school math teacher in South St. Paul. We are very excited for tonight's event, but before I hand it over to Representative Craig, I'd like to go over the agenda for this evening. Shortly, Congresswoman Craig will provide an update on her work in Congress. And then Lisa Brodsky, the Director of Public Health in Scott County, will give an update on the coronavirus pandemic. Following their remarks, I'll be asking questions that you all comment below. This town hall, we need to remember, has Minnesota rules, which means we will all treat each other with respect. Tough questions are great and welcome. Obscenity, not allowed. Those questions won't be asked. I'm a school teacher. I will be driving this bus. So with that, I will hand it over to Representative Craig to lead us in the Pledge of Allegiance and to give us her opening remarks. Mother of the groom, Josh, Miss Angie Craig.
Thank you so much, Jessica, and thank you for moderating the event tonight. Hello, CD2. We always start our town halls, whether they are in person or virtually, doing two things. One is I always recognize the veterans who are in the room, who are watching tonight. Thank you for your service to our country. The second thing I want to do tonight is recognize all of the teachers who made it through this school year, adjusting to virtual learning, and the parents who had those children many times home with them. Thank you to our first responders, our healthcare workers, our police, our fire, our EMTs in each of our communities. And then finally, I'd like to lead us in the Pledge of Allegiance before making my opening remarks. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much, CD2. I wanted to start by saying I am back in Washington this week. Hopefully you can recognize the various places I am here at this point. We have a number of important bills that we're going to be taking up later this week, and really over the next 6 weeks. It is going to be an incredibly busy time here for the Congress. I wanted to say thank you to Lisa Brodsky as well for joining us this evening. Obviously, we're adjusting our town hall just a little bit. We're going to ask questions throughout, some COVID related that we'll ask Lisa to comment on from a public health perspective. I may chime in from an economic perspective or what the Congress is doing. And at the end of the day, we'll be asking your questions throughout to me, whatever's on your mind. I wanted to say to start that, interestingly enough, even before COVID-19, healthcare and the economy were the top two issues in our congressional district. Well, in the face of COVID-19, healthcare, the health of our nation during a global pandemic, as well as the state of our economy and how we sustain it through this global health crisis, as well as how we rebuild it once we're through to a vaccine or additional therapies, is a major focus of concern in our congressional district, obviously, and across Minnesota. It has been a balance of both of those things throughout as we face this as a country together. I'm very proud of the work that we have done here in the Congress so far. We have passed 3 bipartisan bills that the president has signed into law. In addition to that, at the end of May, the U.S. House passed the HEROES Act, which provided a number of different funding mechanisms to help us sustain our economy. But we can't forget that at the end of the day, there are 2 things happening here. The first is almost 120,000 Americans have died during a global pandemic. And the second is that we have a 13.3% unemployment rate. nationally and 9.9% unemployment in Minnesota, which is the highest we have seen since 1983. So I know that healthcare and the economy are important topics to each of you, and they are really the core of what we've been working on during this particular crisis. I would be remiss, though, if I didn't say that it feels like a long time ago that we had our last town hall. The brutal murder of George Floyd at the hands of Minneapolis police officers really only begun the conversation about the systemic reforms we need to make in the area of police reforms, but also the topic of systemic racism. As we think about some of the bills that I'm going to talk about in just a moment, it's important to note that what that really means is that there are severe disparities in our country for Black Americans in things like education, in housing, in employment, in so many opportunities in our country. And in Minnesota, we know those disparities are greater than in any state in the entire country. I want to start by saying, though, how delighted I have been, how touched we have all been by the response to Mr. Floyd's death throughout the 2nd Congressional District. In fact, we have had a number of things like pop-up food banks to help the folks in South Minneapolis. We have had a number of peaceful protests in places like Hastings and in Red Wing and in Lakeville and in Eagan, in places that the idea of organizing on behalf of racial injustice in this country that led to the death of George Floyd perhaps has never occurred before. So I just want to say to each of you who are concerned about these issues that the Congress is going to take bold action this week. We are going to we're going to take up the Justice in Policing Act, which will make a number of important reforms. I have been working with and discussing and listening to many members within my community, particularly within the Black community in Minnesota, my colleagues in the Congressional Black Caucus, particularly my freshman colleagues of color who have a particular point of view that I think is important to listen to, and also talking with local law enforcement in the district, Sheriff Tim Leslie and Sheriff Luke Henning, Dakota County and Scott County, to understand what the impact of the reforms that we're discussing here in the Congress will be. Most of our communities already ban things like chokeholds in our communities, and there is an overall belief that chiefs of police need more information. And as part of the Justice in Policing Act, that is part of what they will be provided, is more information on complaints related to performance of police officers around this country. This week, in fact, tomorrow morning, I'll be participating in a press conference where we will introduce a new bill. It's called the Patient Protection and Affordable Care Enhancement Act. I'm very proud that the base of this bill is H.R. 1425. It's actually H.R. 1425, and it includes my State Premium Reduction Act. Healthcare, healthcare, healthcare. I spent over 20 years working in healthcare. I grew up in a family without access to health insurance, and I am going to make it my mission to lower the cost of healthcare in this country. I have made it my mission to stand up to big pharma and attack prescription drug prices in this country, and tomorrow will be an important step forward in doing that. We also, here this week, have introduced the Moving Forward Act. This is H.R. 2. This is the infrastructure investment that the president and we have been talking about for the last 18 months. And I've said this before in my town halls that I support the president's desire to do an infrastructure bill. Let's get it done. Last week in the Transportation and Infrastructure Committee, we, over 24 hours of 48 hours, marked up the Invest in America Act, which would provide a 46% increase in surface transportation funding. And the reason that the timing of this is so critical and important is because as we think about the challenges of our country, 13.3% unemployment, almost 10% in Minnesota, we need to address the public health crisis at hand, but we need to turn boldly to stimulate the economy and put people back to work. And I'm so proud to be part of that bill as a part of the Transportation and Infrastructure Committee. COVID-19, too, has really exposed some of the inequities we have as it relates to broadband in this country. So as part of this bill, we are proposing to invest $100 billion over the course of a period of time in broadband funding across this country so that many of my family farmers and many of my parents who have to drive to a local McDonald's to get Wi-Fi, as we think about distance learning, as we look at how remote virtual health care can be taken post-COVID into this new world, it is important and an equalizer and leveler that everybody has access to high-speed internet, and that is a major, major part of this bill. Again, as I said, there are about 6 weeks where we're going to be incredibly busy over the next 6 weeks in Washington for much of that time, or doing virtual committee work or hybrid committee work. The appropriations season is upon us, and I just like to remind everybody that one of my highest priorities in representing this district, and Jessica, I think you'll like this, is fully funding special education in this country. As we think about racial disparities, fully funding our public schools become incredibly important. They always have been. As we look at Title I funding, it always has been. And so this is an opportunity in the appropriations process to make sure that we are fully funding our public schools, to make sure that career skills and technical education are a priority and a focus in this country. With the unemployment rates we're looking at, we are going to have to reimagine our economy. There are some folks who will not have the job they left before COVID to go back to, and they're going to need to be retrained. They're going to need to make sure that career skills and technical education is a priority in this country. So there's one personal aside, and Jessica, thank you for mentioning. My family had a wedding this weekend. We are incredibly proud of our son, Josh. He's a machinist, and he moved to help manufacture ventilator components about 3 months ago, and he brought me a daughter-in-law over the weekend. So we're really proud and very happy for Joshua and Allison. They've been together since the summer after 8th grade. And so it was really an amazing weekend to welcome them finally, Allison, to our family. So with that, Jessica, those are my opening remarks. And just again, thank you so much to you and to Lisa for being here this evening.
Good evening, and thank you for participating. I'd like to thank Representative Craig for inviting me to join her this evening to discuss the COVID-19 pandemic. As of this morning, globally, there are over 9 million confirmed COVID-19 cases worldwide and nearly 500,000 deaths. In the US, we have over 2.3 million cases, and as Representative Craig said, just over 120,000 deaths. It's important to note as well that of these, over 20,000 have been individuals under the age of 65. Just as a comparison, the CDC estimates that the flu has resulted in about 9 million to 45 million illnesses per year over the past decade. In that same time frame, it has claimed between 12,000 and 61,000 lives annually of U.S. residents. The most at risk for the flu, severe flu infection, are children, pregnant women, the elderly, those with underlying health conditions, and those immunosuppressed. For COVID-19, our current understanding is that older age and underlying conditions do increase the risk of severe infection. While we have less cases of COVID-19 so far, however, we have more deaths, many more deaths. While the true mortality it will take some time to fully really understand. The data so far indicates that the death rate, which is the number of reported deaths divided by reported cases, is around 3 to 4% compared to seasonal flu, which is usually well below 0.1%. In Minnesota, we have cases in every county except one. And we have tested about 520,000 people. Of those, as of this morning, 33,469 were positive and 1,393 have lost their lives. Of the people who have perished, 79% were in long-term care or assisted living facilities. It's important to note also, though, that this percentage is decreasing as we see more widespread transmission in the community. And of the deaths in Minnesota, 100 of them have been people under the age of 60 years old. The virus of COVID-19 that causes COVID-19 can affect people in other ways. Some get very sick, while most have mild or moderate symptoms and get better without going to a clinic or hospital. Some may have no symptoms at all, and some people die. Some people are hospitalized for weeks and multiple times. Some need to be put on a ventilator in order to breathe and survive. Some may need to be put on a heart-lung bypass machine. The virus that causes COVID-19 has also been linked to increased blood clotting, strokes, heart damage, and other organ damage. For those that do get better, they may have long-term health problems from the virus. The disease may cause permanent damage to the lung, leading to ongoing trouble with breathing. And we are seeing new evidence that shows that COVID-19 can also lead to health problems in children. It also causes more than physical health problems. It is a continuing threat to the personal, financial, and mental well-being of Minnesotans. There is stress from being in the hospital, losing jobs, as Representative Craig mentioned, not being able to work during the time that they're ill, loss of income, not being able to pay bills, feed your family, and also being separated from family and friends. The state strategy has really been to slow down the spread in order to avoid some of the problems that we have seen in other states related to overwhelming the healthcare system. So far, we've been successful. As we turn the dial to open up the economy, which is critical to the health and well-being of Minnesotans, we're doing it safely and watching for any negative effects. We are working hard to ensure that people can get back to work without overwhelming hospitals and putting lives at risk from COVID-19. Thank you.
Thank you both for your deliberate and intentional work and that helpful insight. So now we are on to the question and answer section of the evening. And we had a few questions submitted beforehand by constituents to give everybody else some time to add their own questions in the comments below. So this first question is going to go to Representative Craig. It is from Natalie in Farmington, and she asks, what relief can we expect from Congress? Will there be another stimulus?
Well, that's a great question, Natalie. As you may know, the House does believe that we need to act deliberately here, that we need to act quick. You know, I have been in close contact with Neil Kaskari, who is the president of the Minneapolis Fed, over the last several months. And, you know, what we're trying to balance here is obviously managing the health aspects of this with also the economic aspects of the public health crisis that we find ourselves in. And his view is that, the most important thing that we can do is to make sure that those who have been laid off have access to assistance in the form of unemployment insurance. The HEROES Act that the House has passed, awaiting action in the Senate, does extend the unemployment insurance benefits that the federal government provided as part of the bipartisan CARES Act. Why that's so important is because people need to continue to pay their mortgage. They need to continue to pay their rent. If we can stave off the next domino effect of the crisis and prevent a banking crisis in this country. Those are some of the domino effects. One of the, I think, most important things that we'll be fighting for in this next bill will be direct assistance to our local cities and towns and counties, as well as more assistance to the state of Minnesota and states around the country. Minnesota was lucky. We have been fiscally disciplined. We had a rainy day fund over the course of the years that Mark Dayton actually put into effect. So we have been able to cover some of the additional expenses of COVID. But if I think about just Dakota County, for example, alone, the Dakota County commissioners, we had a meeting a couple of weeks ago, and they're expecting about a $35 million hit to expenses as a result of COVID-19, direct result. Each of our communities are really suffering. And if the state of Minnesota, who obviously has to balance a budget under state law, they are not able to run a deficit, and that means that the only option we will have is to start cutting important departments like the Department of Education, start cutting our school budgets, start cutting the assistance to our colleges and universities, which already have been decimated, start cutting the Department of Transportation budget at the very moment where interest rates are zero, and we should be doubling down on the investment in our country, because that too is going to put people back to work. So I think that those are going to be important things for the next COVID package, making sure that we are continuing to provide direct assistance to state and local governments. As far as I'm concerned, anything we need in order to invest in getting to a vaccine as quickly as possible, invest in personal protective equipment for our first responders. There are so many things we need to do in this next bill. And what we really need is the Senate to take up the HEROES Act or pass its own bill. And my fear is that Senate Majority Leader Mitch McConnell is trying to run out the clock on the unemployment insurance benefits, which expire at the end of July. But there are some serious consequences here if the Congress doesn't continue to take bold action. The Federal Reserve, too, needs to take continued bold action. And at the end of the day, what we're trying to accomplish is to prevent our country from entering into a second Great Depression. If we only come out of this in a recession, which apparently we entered in February, then we're going to have something to look back on and say we managed that under difficult circumstances as well as we could.
Thank you. This next question is for Director Brodsky. This is from Wes in Lake City. And Wes asks, why is the percentage of COVID deaths at nursing homes in Minnesota so much higher than other states? And what is the exact rate of deaths now? Lisa? Lisa, can you hear me? I'm not sure if Lisa can hear me right now. She looks a little frozen. So I am going to move to the next question, which is from Linda in Rosemount. This one is going to go back to Representative Craig while Lisa is able to look at her technology. Mm-hmm. And Linda in Rosemount asks, what is your view of POTUS terminating the U.S. relationship with the World Health Organization and relatedly appointing a vaccine czar to lead Operation Warp Speed?
Well, I I do question the administration's policy of canceling our partnership, our leadership role in the World Health Organization in the middle of a pandemic. The idea of having a vaccine czar, I don't oppose it at all. In fact, many of you know I look for opportunities to support the administration. And if that strategy complemented our partnership with the World Health Organization and other countries to make sure that we are involved instead of isolating ourselves from this process, I have such great faith in American innovation, and I know that Dr. Anthony Fauci was optimistic, cautiously optimistic today during his testimony here in Washington about our ability to get to that point of a vaccine. But I also wish the administration and the president would think about having a supply chain czar. A supply chain czar to make sure that at the federal level we're getting the testing components where they need to be, when they need to be there. You asked Lisa just a moment ago about those long-term care facilities. I think that that is one area where the federal government really having a supply chain czar could have made a significant difference to make sure that that PPE went to those long-term healthcare facilities, to those hospitals, to our food processing plants in order that our food supply chain wasn't disrupted. So, I think the idea of a vaccine czar is good as long as we don't work in isolation. But at the same time, I don't think it was wise to pull ourselves out of the World Health Organization at precisely the time that we're going to need our allies most as we get to a vaccine, and then figure out how we distribute it really when everyone at the same time around the world is going to be in significant need.
Thank you for that. Okay, I think Lisa is back. So we're going to circle back to Wes's question about the percentage of COVID deaths in homes in Minnesota and why it is so much higher here than in other states. And if you know what the exact rate of death is as of now.
As mentioned earlier, it's about 79% in long-term care facilities. However, it's important to note that the long-term care facilities that are included in those deaths are counted differently in Minnesota than other places. Other states are only counting their skilled nursing facilities, whereas in Minnesota, we include all of them. We include the skilled nursing, we include the assisted living, we include the rehab centers. So it's not apples to apples in those comparisons.
Okay, makes sense. Thank you. This question is for both of you. I think I will have a Representative Craig answer first. This is from Jameson in Apple Valley. And Jameson asks, why won't you support the president and his attempts to reopen the economy? The dangers of COVID-19 are almost completely limited to our older and less healthy citizens, and the infection rate is much larger than previously expected. These two items indicate that we need to open up our economy while protecting those at greater risk. Why is science such an important factor when it comes to shutting down the economy, but not nearly as important when it comes to reopening it? Representative?
Well, Jameson, thank you for the question. It's an important question that we ought to ask and we ought to be talking about here. And, the truth of the matter is that the president has delegated the decision about whether to close each state to the governors of the state. I don't agree. I think he should have had, the administration should have taken a more leadership role in areas like supply chain and our federal testing strategy and our PPE strategy. But if you look at the data, and I'm going to put my cheaters on here, 1 in 5 new cases worldwide right now are coming out of the United States. And so, we have been looking at a number of data points, and America is about 4% of the world's population, and right now we're seeing cases surging in about 24 states, mostly in the South and the West. And so these are really, as you can see, difficult decisions that each state and our governors are making based on they are supposed to be basing these reopening decisions, for example, on the CDC guidelines, the guidelines that are coming from the administration. Many of these governors have decided that they are going to turn the dial a little further than Minnesota has. And I know that has led to some anxiety and stress among small business owners and members of our community, and particularly in rural areas where perhaps you don't have as many cases or as many deaths. I know the governor has had some tough decisions and tough choices, but I think about, and I want to just reinforce my point, what do I think? I don't think it's constructive to back up and say, well, the administration should have been doing X 3 years ago. But what I do believe as a member of Congress, it is absolutely crucial to say is, look at how a country like Germany has handled COVID-19. They've got more than 83 million people. They flattened their curve. They had a peak of 6,000 new cases a day, and now their numbers are around 600. What did they do different at a federal level than us? Well, if you look at that, it was robust testing. They didn't have various localities competing against one another for test or testing components or for personal protective equipment. They were at the center of that. And robust contact tracing, quickly isolating the cases when they find them to stop the spread. Part of my job as a member of Congress is to look at the facts of how other countries are handling these things. And apparently they stood up 400 call centers across the country with dozens of employees at each of these call centers. And they prioritized the tracking of cases so that they could find out who's got it, isolate them, keep them away from other people. And so, if a country slows down testing, it doesn't do contact tracing, then you have this challenge of how do you open up the economy when you're turning that dial, as the governor has done, you are risking the spread of COVID-19 broader in your population. So, I asked the Minneapolis Fed chair in my last conversation with him, what is your biggest concern for the economy? And his answer surprised me a little bit. His biggest concern for the economy is that the state of Minnesota and that states around the country open up too quickly and end up having to slam the door shut again. And as we see those over 20 states around the country where we see cases surging, I think that is the risk that the Federal Reserve Chair and Mr. Kaspari are concerned about. And so it is a difficult thing. I know the stress and anxiety of our small businesses has been tremendous. We have almost 400 cases in our district office from our casework team trying to help these small businesses get access to Paycheck Protection Program loans, advocating to change that program to make it better for folks. And at the end of the day, it's an important question. And I hope we can all continue to recognize that we have got to balance the public health challenge we have with the economic challenge that we have as a country.
Thank you. Certainly makes it difficult when COVID doesn't recognize our state boundaries and we're all doing something different. Director Brodsky, what are your thoughts about, as from a public health expert standpoint, about reopening the economy?
First of all, I agree with everything Representative Craig said. We want to reopen the economy, but it is critical at this time that we do it safely. We know people are hurting. We see people unemployed. We see people, we are assisting and see people in line at the food shelves that have never had to request assistance before. So we know that it is important to do so, to open up the economy. We also know that we need to be cautious. We are learning lessons from our other states in the country, ones that may have opened up too quickly. They're seeing surges, and we don't want to repeat those mistakes. We want to make sure that we do it safely. Even now, as we open up the economy, we are starting to see some surges and some outbreaks in some service industries that are connected with certain service industries that have reopened. We don't want to have to go back and dial it back. We want to make sure that we move forward. But again, it is critical that we do it safely and don't cause a second wave of the virus.
Wonderful. Thank you. Okay, this is the last pre-submitted question. This is from Jay in Burnsville. And Jay says, nurses at the hospital where I work are still being required to reuse the N95 masks and other PPE multiple times. Most of these items are labeled for single use. We have paused surgery and closed many medical locations to conserve use of PPE and build inventory. Very little has changed since April, and managers admit that we are short of certain PPE supplies. Why are we still reusing PPE, and can you investigate this? Representative Craig.
Well, the answer to your question, Jay, is yes, the House can investigate this. We want to understand this better. But the truth is, we've all read the stories and we've heard the testimony. States have been asked to compete against other states for access to personal protective equipment for nurses like you. The federal government at times has come in and swooped and taken the personal protective equipment away. My county health officials tell me that for a decade now, we have not been investing enough in those stockpiles at the county level. We certainly haven't been investing enough in stockpiles at the federal level to be able to handle a global pandemic. Look, I think that it is not too late to take a different federal strategy here, and that is one where the president more both effectively and also more judiciously uses his authority under the Defense Production Act. During testimony today, we heard that the president has used the DPA, I think it was 3 times as it relates to N95 masks, having 3M, good Minnesota company, ramp up production as quickly as possible in other locations, and also having 2 additional private companies adjust to be able to manufacture these N95 respirators. We could be doing that all over this country. There is no end of companies who are willing to step up and help us produce this equipment. What the DPA does is it gives the president the authority to basically help restructure a manufacturing facility to make this available. And what it does is it gives 3M the opportunity to license their product to another manufacturer so that we can ramp up this production much more quickly. We could have done this with the swabs that we've been really sorely needed on the testing side here over the course of the last several months. And I just want to say it's not too late. It's not too late for the federal government. I know we feel like this has been going on forever. I will remind you, we had Mike Osterholm, really world-renowned from the University of Minnesota, epidemiologist, on a couple of months ago, and he said to us we're in the first or second inning of the global pandemic. So, you know, I know this is a challenge for hospitals. I know it's been a real challenge at our long-term care centers. I know it's been a challenge in our food supply chains, and it's not too late to take a more robust federal strategy.
We're in this for the long haul for sure. Director Brodsky, what are your thoughts? Shortage on supplies for personal protective equipment?
Well, first of all, as with any supply chain, it's going to take a while for the system to right itself. You know, we saw this unfortunately, with the toilet paper issue. You know, now we're just starting to see toilet paper on the shelves again, and it's been 3 months. They also have to remember that a reusing strategy is better than no PPE. That's also critically important. And we have entities and facilities that are now required to use PPE that have never had before. So, for example, Representative Craig mentioned, long-term care facilities. These are entities that typically have not used N95, but because they have so many cases and so many deaths, they are being issued some N95s also with a reuse strategy in order to curb those. The law enforcement is also is utilizing PPE now, more of those N95s that really haven't in the past. So really, it's just a way to have a better strategy and have a better way of protecting themselves until such time as the supply chain rights itself.
Great, thank you. Good analogy with the toilet paper. Yes, now we finally have that. And it also takes time to transition a company over from making their product to making these things. So we do know that there is going to be that lag time. So thank you for reminding us of that. Okay, so this next question for Representative Craig is from the comments. Lucas asked, Representative Craig, what have you and your colleagues been doing to ensure people in our district don't go bankrupt from a COVID-related healthcare expense? Great question.
Well, it's a great question, Lucas. And we've been working here on the House side to try to codify in federal legislation that no individual will receive a bill for treatment for COVID-19. We were able to successfully pass through the testing component, being able to get a COVID-19 test without regard to your ability to pay. But it has been more challenging, more difficult on a bipartisan basis to get the full treatment regime to be agreed to by the administration. It's also important, too, though, to remember that we had an opportunity here during the course of the COVID-19 pandemic to reopen the federal exchanges, to reopen insurance so that people could sign up during a global health crisis. And sadly and unfortunately, Minnesota certainly moved forward to do that, but that has been, again, left to governors. Some states have, some states have not. And again, if you think about this global health crisis, it's certainly exacerbated the healthcare disparities that we have in this country. If you have good health insurance, even if you have employer-sponsored health insurance anymore, that doesn't mean that you have a deductible that is reasonable anymore. It doesn't mean that your prescription drug costs are reasonable anymore. These are some of the very topics that we're going to be addressing here this week as we introduce this new bill around making sure that Americans have that access to healthcare in our nation.
Thank you. This next question is for Director Brodsky from Karen. And Karen asks, how do we get the word out about the dangers of COVID-19 to young people? She has friends who have survived the virus, but now have long-term complications to this disease. And it doesn't seem like anyone is focused on these long-term effects. Can you tell us about that?
Well, the information is out there, and this really is, the million-dollar question that public health has really been struggling for years, even before COVID. Connecting knowledge to action. We see it in healthy eating, active living, substance use. Youth, teenagers, they think they're invincible. They hear that it's mild for youth. And we know, it's mild for many youth, but there are some significant health issues and connected. And, I've just spoke with a teenager the other day who just graduated, and she's looking for a place to go get tested for COVID because she was at a graduation party with more than 10 kids and got a call a few days later that someone now has COVID. She admitted she knew she shouldn't be there. She knew that there was a risk, but they just don't think that they're going to get it. So the insurance is out, or the information is out there. We continue to translate it in multiple different languages so everyone has that information. And we will continue to do so and hope that people change their behavior to match the knowledge and information that they have.
Yes, that's something as teachers we're all worried about when school comes back of how are we going to do the social distancing and making sure that all of our students are safe. Okay, next question for Representative Craig is from Bill. And Bill asks, what are your insurance coverage for municipalities to hold police departments accountable? The League of Minnesota Cities insures many cities and police department. That's the League of Minnesota Cities insures many cities and police departments. They can hold police departments to a higher standard if they want settlements paid. What are your thoughts on using insurance coverage?
Well, I think, most municipalities would carry that kind of insurance coverage. And I think the Justice in Policing Act does a few things that this perhaps is a good opportunity to talk about. One is it also ends the qualified immunity doctrine that is a barrier to holding police officers accountable for their wrongful conduct. I know that this has been a part of the bill that has received a lot of attention, but certainly I believe most municipalities carry coverage. And, at the end of the day, we want officers to do a number of things, but mostly we want them not to racially profile. We want to make sure that there is additional training on racial profiling so that they understand what that looks like and it stops. When you think about banning chokeholds, many of our communities already have banned chokeholds, but certainly that is something that is in the Justice in Policing Act. There's data collection, including body camera, dashboard camera, and other things. And so, all of this helps establish new standards for policing that, if you look at many of the instances of Black Americans, Black Minnesotans who have been killed by police, these things, I believe, the Congressional Black Caucus believes, will be instructive and helpful reforms.
Thank you for that. Next question is for Director Brodsky. We'll just keep going back and forth. This one is from Sue, and Sue asks, with many parts of the country experiencing record numbers of COVID cases, what can we do in Minnesota to stay safe and keep our cases low? How do we balance opening our businesses with keeping the public safe and COVID rates in check?
Thank you for the question. I really appreciate it. I think businesses are doing a lot already and need to continue to do so. Social distancing in their facilities, some requiring masks and prefer all of them to require masks. Using good cleaning techniques after customers. I know Scott County has reopened some of our businesses services by appointment only, so we're limiting the number of people inside the facility and doing rigorous cleaning afterwards. I was very impressed the other day. I was at a hardware store, and every single person in that store was wearing a mask, cashiers, customers, etc., and maintaining that 6-foot social distance. We want businesses to be open again, but we want them to do it safely. Some of the things that we're seeing that I think we can do a better job of, because I have been receiving calls from employees who have either been sick or have tested positive for COVID, and their employers want them to come back to work. Especially in the service industry, we just can't do that. We need businesses to have some flexible leave policies to allow people who are positive to stay home the correct number of days until they are cleared to go back to work, because all that's going to do is infect other employees and the public. So to keep that down, we really want people who are sick to stay home.
Thanks. That's hard to do. We are hard workers in the United States. We just all the time. So that we need to keep hearing that. We have permission to stay home when we're sick. Thank you. The next question is for Representative Craig. It comes from Lisa. And Lisa asks, there's a concern about the impact of the president restricting H-1B visas on our farms, meat processing plants, as well as the medical field and other high-tech sectors, which rely on foreign-born labor. Will you ensure the administration understands the impact restricting these visas would have on our communities?
Lisa, thank you. And you're exactly right. When I talk to the family farmers in my congressional district, one of the things that they say to me is that they need more folks who can work year round and access to additional visas to make that happen. In fact, earlier this year, the House, and was this year or late last year, passed the Workforce Modernization Act, which was specifically for the ag community and ag economy. When you talk to economists, the most significant thing that we can do in this nation to actually accelerate GDP growth is comprehensive immigration reform, making sure that immigrants can come here, are able to can start a business if they want. 40% of Minnesota's Fortune 500 companies were actually started by immigrants or children of immigrants. So it's critically important. We today, with the announcement by the administration, have already started hearing from the chambers of commerce, asking us to have conversations with our colleagues across the aisle. It just doesn't make good economic sense.
Thank you. We're going to stick with Representative Craig and go to the next question, which is about your views on liberty versus safety in the context of masks. I mean, we have restrictions in our lives, like seatbelts and stoplights, highway speed controls, food safety regulations, and many others. Should we be wearing masks, or should wearing masks be seen in the same light, or should it be, as some say, it's my choice to wear one or not? What do you think?
Well, it's, you start with, during a global pandemic, I want to listen mostly to county health officials like Lisa Brodsky, to Dr. Anthony Fauci, the medical experts who tell us the most important things that we can be doing, both to keep ourselves and our families safe from COVID-19, but also having the common decency of protecting other people. And I see our neighbors have really come together during this pandemic. And it breaks my heart that masks during a global pandemic have somehow been politicized. That's the last thing in the world that we should be doing at this moment. Look, the medical experts tell me that the most important things that we can do is physical distance, wash our hands, wear a mask. And so, again, I would hope that to take care of one another. Again, let's not politicize this. At the end of the day, we're all trying to help our neighbors. We're trying to help folks get safe. 51% of this congressional district, for those of you who live in CD2, a full 51% of the non-elderly in this congressional district has a pre-existing condition. You don't know what kind of risk you may be posing to your neighbor, to someone else, if you're not wearing a mask. And so I just have to believe that we can be there for each other. And that, again, your point is well taken, David. We are asked in order for the safety of our country to do certain things that aren't our choice. And certainly, I would hope that each of you would choose to wear a mask when you can't physically distance.
Director Brodsky, do you have any thoughts to add, or your views on wearing a mask from a public health expert's point of view?
Certainly. It's interesting that in the question, you're looking at seatbelts, highway safety, traffic control lights, food safety regulations. Those are public health initiatives that save hundreds of thousands of lives a year. And yes, that should be seen in the same light. Until there's a vaccine, there's very little we can do except for wear a mask, wash your hands, and social distance. And it impacts us all. There's economical impacts. I mean, we want this to go away. We want to reduce the impact. And if those are it seems like a small thing to do to protect others and ourselves. So from a public health perspective, this should really be included in the items listed, because it will save lives.
Thank you. All right, I think we have time for one more question. This one is close to my heart. This one comes from Dan. And Dan asks, Representative Craig, how can we promote voices from educators of color?
Thank you, Dan, for that amazing question. And it's so critical, and it really speaks to the heart of making sure that the disparities that exist in this country, that we battle these. And I think about at the state level, which of course, I think the federal government can also support, is a commitment to increase the diversity of our teachers is critically important. Over the course of serving in Congress, and this is so incredibly important to me. My wife taught public school, middle school for 22 years. I'm the daughter of a teacher. And what I know is that the data backs it up. If one Black child has one teacher of color during elementary school, I believe it's like a 13% greater chance of going to college in this country. And we've got to make sure that we give Black and brown children the opportunity to see themselves in those roles. At the federal level, with respect to education, one of the things that I think we can do is there are some bills around diversity, so strength and diversity. I think there's a bill called the Strength and Diversity Act. That again is aimed at, how do we make sure that we eliminate racial disparities in especially the early years, the socioeconomic isolation and publicly funded early childhood education programs. And at the end of the day, I think from an education system perspective, just think about how our system in America is organized. Our system is organized so that communities who are affluent have access to taxes. And so those communities who are less affluent, where home ownership is less, those public schools are less funded. And so at the federal level, that is why I've always believed that the entire purpose at the federal level of the Department of Education is twofold. One, it's Title I funding to make sure that the disparities between our schools across this nation are nothing, are zero. I know that's a big challenge. And fully funding special education in this nation, because one of the important things is that our public schools really need to have the resources in order to pay our teachers, to recruit the best. I'd love to see more programs within historically Black colleges to recruit teachers. Again, it's so important. And at the end of the day, the other thing, and I'm going to mention this even though this wasn't part of the conversation, but the kids recently in Eagan at Eastview High School, the Black Honor Association. I was out after George Floyd was murdered in my community, and these kids were, just on Facebook had said, hey, come donate. And for hours, these kids collected things to be able to take over to South Minneapolis and help their community and their neighbors. And what they said to me they needed most was the inclusion of Black history as a required component, just the God's honest truth of Black history in our country, all 400 years of it in American schools. And so I think, facing the history of this country, understanding that each of us has a role to play to say, you know what? It's my responsibility. It is my responsibility to help end systemic racism in this country. And so there are so many things that I think, I'm listening to, that I'm advocating for. And at the end of the day, this is all of our issue. This is not Black Americans' issue. This is our issue. We need to own it, and we need to work together to fix it.
I so appreciate that. There are statistics that also show that having a teacher of color is beneficial not just for students of color, but also for their white peers as well. So Thank you for speaking on that. That was our last question. So I'm going to hand it back over to you, Representative Craig, if you have any closing remarks.
Well, Jessica, thank you so much for moderating this evening. I have so enjoyed now my 18 town halls since I've been sworn in as a member of Congress. And Lisa Brodsky, thank you for being here today. I personally believe that politicians shouldn't be the one answering medical questions. We certainly have to understand it, have to study data and facts to make decisions. But at the end of the day, we really value your contribution to the county and to the 2nd Congressional District. I just want to end a little bit where I started, and that is that there is so much work left to do, not just in this Congress, but across this country. And I just want to say thank you to the members of this community who come each month to ask me candid questions, hard questions, often controversial questions, for the way in which you go about it. See, I'm still really proud of my bipartisan rating. Currently, I have sponsored over 450 bills, and I have written about 30 more. 80% of my bills have Republicans on it. See, I think this country can't move forward unless we're willing to listen to each other, unless we're willing to work together. And I really appreciate all of you who come to have your voices heard. This is what democracy is really all about. I also appreciate those of you who have been peacefully protesting over the last several weeks. Racial inequality, racial justice issues are something that our community, and now, of course, the state of Minnesota, with its focus, we need to lead on. And I'm so proud of our community in CD2 to step forward and help each of our neighbors. So thank you again to this incredible congressional district. Thank you for each of you for being here this evening. And I look forward to my 19th town hall next month.